The United States, land of the free, home to a single-payer healthcare system. Personally, I have been able to grow up with top-quality healthcare through the help of my parents, but for many other Americans, this is now deemed a luxury. It is possible that many of you in this room have seen you or your loved ones struggle with healthcare expenses. I have always been interested in studying the healthcare field, and today I often find myself reading about the prevalent issues surrounding the United States healthcare system. Despite being one of the best countries for healthcare, there are several Americans who are left uninsured and unable to afford quality medical care. Because many Americans are left struggling, the proposed solution by many is to implement a single-payer healthcare system. Today I'm going to tell you about what a single-payer healthcare system is and the controversy surrounding this model, as there are many pros and cons to it. According to the Physicians for a National Health Program, a single-payer health system is a system in which a single public agency takes responsibility for financing healthcare for all residents. The government or agency operates a tax-funded health insurance program for all residents, while the delivery remains in private hands. The necessary medical services provided in a single-payer healthcare system may include doctor and hospital visits, reproductive health care, dental, vision, prescription drug, and medical supply costs. In today's society, equity is a major point of interest for people. In the U.S., not everyone has access to quality healthcare. There are people who can afford top-of-the-line healthcare and others who cannot, as it is cost prohibitive. Because of the inequity, it is believed that we must create a system where all Americans are able to obtain quality medical care. The Affordable Care Act was enacted by Barack Obama in 2010. Its goal was to make healthcare more affordable to Americans. 20 million Americans have benefited by receiving insurance from the Affordable Care Act. But despite the enactment of it, there are still nearly 30 million Americans without health insurance. Because there are so many Americans left without it, the solution that many have proposed is a single-payer healthcare system, a system that could potentially benefit all Americans. So this is what a single-payer healthcare system looks like. The federal government ultimately provides the bureaucracies through funding, and then the bureaucracies such as the hospitals and health providers obviously provide to the patients, but the patients have to fund it themselves through their taxes, which is given to the federal government. But this is just a flow diagram for it. There are several potential benefits to implementing a single-payer system. A single-payer healthcare system could save lives and eliminate mortality that is preventable. According to health researchers at Harvard University, a lack of healthcare is associated with as many as 45,000 deaths per year. This translates to a 40% increased rate of death amongst those who are uninsured. Not only would this system get rid of preventable mortality, but it would also lower the cost of healthcare in the United States. According to a study from the University of Massachusetts at Amherst, under a single-payer system, total public and private healthcare spending could be lowered by up to $1.8 trillion over the next 10 years due to lower administrative and prescription drug costs. The country would be able to save more money and experience economic growth. Despite the positives associated with a single-payer healthcare system, there are still downsides to it. If we were to implement a single-payer healthcare system in the U.S., there would most definitely be a shortage of doctors. The Association of American Medical Colleges has predicted a shortfall of over 100,000 doctors by 2030 alone. If the single-payer system would be put forth, the shortage of doctors could get worse even sooner. Countries like the United Kingdom ration their healthcare through service restrictions. Wait times for cancer treatment, which may be a matter of life and death, are far too long. According to National Health Service data in England, almost 25% of cancer patients in 2019 didn't receive treatment on time, despite an urgent referral by their primary care doctor. Another issue is the quality of care and availability of disease screening and treatment. In countries with government-funded healthcare, certain disease outcomes are worse than the U.S. The 5-year survival rate for all types of cancers in the United States is 67%, compared to 60% in Canada and 54% in the United Kingdom. The United States is also ranked higher for survival rates with breast cancer and strokes. The diagram right here below shows certain single-payer healthcare systems like Canada, Sweden, and the UK. The US has the lowest satisfaction rate, but Canada only has a 9% increase. We have to look at the pros and cons of a single-payer healthcare system. Although this healthcare system may seem ideal for many, the quality of care delivered may not be the best. There are certain positives and negatives to a single-payer system. We have to measure the costs and potential outcomes for every patient under a single-payer system. The ultimate goal of the U.S. should be to provide quality and affordable health care for its citizens.